Hello everyone. This is third lecture in the series of lecture that we are presenting with Cancer Bridges for preparing you for upcoming cancer related treatments. Whether it is chemotherapy, radiation, or any surgical procedure that you need to undergo for cancer related treatments, we want to prepare you for these treatments so that you can undergo the treatments better, come out stronger, and recover a lot faster. These treatments are very simple interventions that you could do as a part of pre-rehab or preparation for upcoming treatments. In short, pre-rehab means we are beginning rehabilitation for our own self prior to the treatments. We are already preparing for an upcoming marathon. We are not waiting for the day of marathon to start running. We are doing our small exercises, our small runs, so that on the day of marathon, we can just go faster and run stronger. This is very similar to that. In my first lecture, I had mentioned about, this is a medical disclaimer. I have tried my best to have evidence-based practices presented in these videos, but I would recommend you to talk to your nurse practitioners, to your physicians, make sure you're allowed to do these interventions prior to beginning them. I have tried to put together the simplest form of interventions so they could be applicable to any gender, any age group, patients with any level of physical abilities. Whether you are super active or you're just beginning your physical activity journey, these interventions could be used for one and all. In short, there are 4 steps to pre-rehab: screening, assessment, interventions, and monitoring. I am focusing on interventions. There are 2 types of interventions: universal interventions and specific interventions. I am focusing on universal interventions in this series of pre-rehabilitation. Today, we are going to talk about the second universal intervention, which is whole body mobility exercises. These whole body mobility exercises could be used for any patient, again, who, no matter what kind of cancer you have, no matter what kind of treatment you are about to undergo, you could use all of these mobility exercises to help you move and tolerate the treatments better. We all know that motion is lotion. There are several benefits of mobility exercises. It improves your range of motion. It also maintains your existing range of motion. Let me give you an example. For example, a breast cancer patient who needs to undergo radiation on the affected side and does shoulder exercises to make sure that the range of motion is really good, or starts doing the exercises to improve the shoulder range of motion, that person can tolerate the treatments so much better, have better exposure to the radiation beam, and get the part treated better. That's why range of motion exercises or keeping your range of motion is so important prior to beginning your treatment. You could start this even 3 days before your scheduled procedure. You could start this 3 weeks before your scheduled treatment. It will still benefit you. So that's why improving or maintaining your range of motion is very important to help you prepare better. The other benefits of mobility exercises: it improves activation of the muscles, it reduces the risk of injury, it helps you to recover better post-surgery, it improves your tolerance to pain, it has shown to have better surgical outcomes, and it obviously improves blood circulation to the parts that is being moved. It also has other benefits on the nervous system, on the lymphatic channels that is passing through all of these smaller and bigger joints. That's why motion is lotion does not just applies to the muscles, but it is soothing lots of other systems in your body: the nervous system, the lymphatic system, cardiovascular system, musculoskeletal system, all of these systems are getting their benefits when you just practice this very simple exercises. These are just few examples of mobility exercises. If you're already doing something as a part of your physical activity, you could continue doing that. But if you're looking for something new, something simple, then these exercises would be very helpful for you. I have tried to keep them very simple so that anybody of any physical ability can do these exercises. I have tried not to use any equipments or any complicated moves because I wanted to benefit. I want these exercises to benefit one and all. Let's go over a couple of types of mobility exercises. The first one is lower extremity mobility on a yoga mat. You could do this on a yoga mat if you're able to get on the floor. You could do these exercises laying on your bed if you're not able to get on the floor. These exercises could be done several weeks or several days prior to beginning your treatments. As soon as your doctor allows you to start moving, to start mobilizing your body, these exercises are great for post-surgical mobility. They are great to help you transition in and out of the bed better. They are great to help you start walking after your treatments are completed. So the first one is ankle pumps. These exercises, the ankle pumps, are very, very simple mobility for your ankle joints. But they help you not just to improve the blood circulation in your lower extremity, they also prevent post-surgical complications like potential of blood clots or potential of pulmonary embolism after you have undergone a surgery, after you have after we undergo surgery, we are not moving a lot, we are pretty sedentary, but we want our blood to keep moving. We want the fluids in our body to keep moving so that they all don't become stagnant and give you other post-surgical complications. Ankle pumps are so easy. You just move your ankle up and down like you're pressing on gas and releasing the pedals. Very, very simple exercises. You could do 10 or 15 repetitions in one session. These next ones are kind of like windshield wipers. They help you mobilize your entire lower extremity from the hips, from the knees, and your ankles. You don't have to strain any ligaments. I don't want you to strain any muscles. I don't want you to give additional pressure on any joints. Whatever you are able to move very comfortably, I want you to move in that range of motion. Our aim is not to strain one part to improve the other part. Our aim is to just move comfortably. The next form of exercise is figure of four, again, to help you move your hips better. If you have any surgical scar in your abdomen, if you're about to go any surgeries, for example, related to colorectal cancer, these exercises helps to improve the mobility in your lower part of the body. They will help you move better in the bed. They will help you sit better in the chair. And they are just very, very soothing when you're not able to do other difficult form of movements. The next form of exercise, if you are able to comfortably bend your knees without straining your abdomen, without straining anything in your upper body, just moving side to side to include some rotations in your lower back, in your pelvis, and in your hip joint. So these are very, very simple rotational movements for the lower half of your body. Again, I don't want you to be holding your breath. I don't want you to be straining your abdomen or your lower back. Move in your comfort zone so that you feel good after you are done with these movements. You could do 5 to 10 repetition on either side in one session. If you are able to move your knees to your chest, this is the fourth form of lower mobility exercise, where you could move your knees to your chest for a good stretch to the lower abdomen. So I'm going back to the rotational movement first. And then you could do this very simple motion, which is knee to chest. Aim is not to compress our abdomen. We are not trying to put pressure on any organs or any muscles or any tissues. We are just trying to move within our own range of motion that feels comfortable to us. Breathing in, breathing out with each movement. Let's go on to the next form of exercise, which is upper mobility exercise. You could do these sitting at the edge of your table, edge of your bed, on your chair. If you're able to get on the floor, you could do these seated on the floor. Again, these exercises are very simple, no equipments are required, and I want you to focus very well on your breathing, breathing in with every move, breathing out after the move is done, and keep going within your own suitable range of motion. So we are focusing on the upper half of the body. We are focusing on the neck, the chest, and the shoulder joints, but they also include your elbow and your wrist joints. So let's start with the neck range of motion. Really, really helpful when you're laying in the bed for long hours or laying, for radiation treatments in supine. We don't want to strain our neck. So this is the first movement of the neck, moving your neck front and back. Nice and comfortable. Do not hold your breath. Go really nice and easy, breathing in and breathing out. Thinking about bringing your chin to the chest. And this is neck side bending, where you're bringing your ear close to your shoulder, keeping everything nice and relaxed. There are several lymph nodes around your cervical muscles, around your neck muscles. So doing neck range of motion is very, very helpful, not just for the nerves, not just for the spinal cord that is passing on the back of your neck, but also to help you breathe better, to move the lymphatics tissue, the lymphatic fluid better, so that you also can tolerate sleeping positions better. So neck range of motion are simple but very beneficial exercises. We are moving on to shoulder rolls. You're rolling your shoulders back as if you're moving your shoulders into the back pockets of your pants. And moving your shoulders clockwise in the frontal plane towards the front. This is another good upper mobility exercise, upper extremity mobility exercise. You're almost thinking of opening the door and closing. Good for shoulder rotations, good for the scapular mobility, which is a bone on your chest, on the back side. Another whole body exercise for the upper extremity, helping your shoulder, your elbow, your upper back motion, improving your chest mobility, increasing the depth of your breathing. Similarly, we are trying to make rainbows. This is shoulder abduction. Very, very helpful exercise for anyone who is going to undergo radiation treatments related to breast cancer or lung cancer. This is what I'm explaining, that if you have radiation treatments coming up, we want this range of motion. This range of motion is very important to have comfortable exposure while undergoing radiation treatments. Just thinking about making slow, soft rainbows on either side of your body. You could also use support of the wall if you do not have good range of motion. Thinking about doing wall walks. You're walking up using your fingertips up the wall and increasing your range of motion. Softly walking up, increasing your range of motion, softly coming down. I keep emphasizing we are not trying to strain any part of our body. We are making it very, very comfortable, very, very soothing for all the joints of the body. But using a simple device like a wall could help improve your shoulder range of motion. So really helpful. The next example of exercises is focusing on your upper chest. We are focusing on the upper chest because this region houses your lungs, your heart, intercostal muscles. This is the transition between your upper extremity and the abdomen and lower extremity. We want to move this part as comfortably as possible. It really helps when you have good mobility in your trunk and your abdomen. You can sleep on your side better. You can sleep in reclining better. You can rotate better. So many benefits. You can breathe better. Lots and lots of simpler benefits, but they are very effective. So let's go over the thoracic mobility exercises. You could do this seated on a chair or on the floor. You want to sit really nice and comfortable. Let's start with the first part of the thoracic mobility exercises. We are making soft pot stirring motions. So I'm almost thinking like my trunk in the center, it's stirring a pot. We are rotating in clockwise and anti-clockwise circles. You could do 5 to 10 repetitions in one session. As you can see here, it is not only benefiting my lower and upper back, but it is also mobilizing my elbow, my wrist, helping my shoulder. I'm also using a little bit of my neck motion. I can make it as bigger circles as possible. I can make them as smaller as possible, depending upon your own comfort level. If you feel like you are having dizziness or you have incidents of vertigo, you can gaze with your eyes at one level and just stir the circles with your lower back. Here I'm making rainbow motions or side bending of the thorax using my side lateral trunk. So not only you doing shoulder mobility, but now I'm extending that movement to my sides. Just think about taking nice big breaths in and breathing out. This is another modified exercise derived from yoga. It's called cat camel, arching my lower back, inflection, and coming upwards, almost like I'm shining my sternum to the ceiling in extension. That is flexion, and coming forward in extension. This is a modified version of yoga-based exercise, which is called cat camel, but I'm doing it in seated. It's not only helping my upper back, but it's helping my neck, my abdomen, my lower back, my pelvis. Let's go on to another example of modified lower extremity exercises in a chair. If you are someone who is not having great range of motion in your lower extremities, or you have pre-existing issues such as arthritis, you have probably hip replacement or knee replacement surgeries, I don't want you to avoid motion, but we rather modify the motion so that we are able to accommodate for our pre-existing problems and still move in a nice, comfortable manner. So I'm showing you seated lower extremity exercises, which you can do on your bedside or on a chair. So I'm seated comfortably in a chair. And I'm going to show you the ankle pumps. Sorry, I need to go back. I'm sorry. I'm just giving instructions of I want you to be very, very comfortable before you do the exercises, as comfortable as you could be. So make sure that you're very comfortable seated in the chair, and you could do ankle up and ankle down, one ankle at a time, or you could choose to do both the ankles at the same time. Slow ankle circles, moving ankles up and down. You could do 30 to 50 repetitions. You could choose to do only 10 repetitions. They're still helpful and effective. Next is knee flexion, knee extension. I have specifically chosen not to use any equipment or any TheraBands because I want you to be okay not having anything, be okay having minimal strength and still able to help yourself. So I'm repeating the ankle pumps on my other leg. Clockwise and anti-clockwise ankle circles. I'm talking about focusing on your breath. You want to breathe in and breathe out and make yourself as comfortable as possible. Do not worry about how far you are raising your legs. Our aim is to move. Small movements are also beneficial. This is hip flexion and hip extension, slow hip flexion or marching seated in the chair. I'm showing modified version of windshield wipers where you're opening your legs like a butterfly wing and closing. I'm talking about not straining your pelvic region, your abdominal region, but rather making these exercises as comfortable as possible. This is a W or reverse windshield wipers. You could choose to do one leg at one time, or you could do both the legs at the same time, depending upon your comfort level. In short, movement is a medicine for creating change in a person's physical, emotional, and mental health. Simple movements are still very lubricating, not only to our joints, but to our nerves and to overall circulation in our body. And all of this is directly and indirectly going to make you feel better and help you prepare better for your upcoming treatments. I hope you find these exercises helpful. You could do one or all of them depending upon your comfort level. I thank you all again for listening to this presentation. My name is Rajvee Shah. I am from Pittsburgh, and I'm hoping me and Cancer Bridges together can make this journey a little bit easier for you. Thank you so much again.